Let's just go in the worst case scenario. I get a bad score on a test and it looks like I'm at risk for any number of cardiovascular issues. What's the one thing I can do to start naturally improving my cardiovascular health? I mean, how can I start?
Yeah, if we're only allowed one, and it
doesn't have to be one. What can I do?
The approach to heart disease, and sometimes we get off track. I'll just go down a rabbit trail. Cholesterol is a risk factor for developing atherosclerosis. It is not the risk factor. There are 20 plus risk factors for developing atherosclerosis. So yes, there are people with a cholesterol 300 and a calcium score of 0. It doesn't disprove 100 years of research because it is a highly complex equation. And I always celebrate people that have terrible risk and come out with a calcium score of 0. I said, you beat the odds. I'm happy for you. I don't get it, but you beat the odds. I had one in the clinic this week that was, really a joyful celebration. Unfortunately, sometimes there's the opposite. Very high scores, very advanced workup, scratching my head. Where's the genetics? Where's the inflammation? Where's the lipids? Where's the homocysteine? It doesn't always fit in everybody's hole and peg. But nonetheless, getting back to it, I mean, it's simple stuff. It is really researching what we know about what halts and prevents heart disease from a nutritional standpoint. And hands down, the only data is a whole food, plant-based diet, low or absent added oils, which is going to be the work of Dr. Dean Ornish, now reimbursable by CMS and other insurance companies, the work of Dr. Caldwell Esselstyn at the Cleveland Clinic, the work of Nathan Pritikin, now deceased, but the Pritikin Longevity Center, again, reimbursed by insurance companies to aid a patient in adopting a whole food plant-based diet associated with stress management and exercise. That would be the single most important thing. And don't smoke, of course. After that, I mean, the list is long. Prescription, know your numbers, treat your numbers. But we really aren't at the stage of regenerative medicine for atherosclerosis like we are talking about for general aging, hair growth, joint health, but yet the risk is phenomenally higher to a person that cardiovascular disease. While you're doing your anti-aging program, if you die of a heart attack, it really wasn't the right focus, and that's why I'm always beating on simple measures, astrocharm.org.